We're live. We're live.
Thanks. All right, good morning, everyone. It's 8:02 on February 22nd, 2022. My name is Deanna Diamore, Health Director for the City of Norwalk, calling the Board of Health meeting to order. Present today, we have board members Ken Lalim, Terry Quell, Norman Weinberger, and Janet Karpiak. We also have Health Department staff members Megan Fogno, Brian Weeks, and Teresa Argandesi. Good morning, everyone.
Morning.
Morning.
The first item on our agenda is approval of the January 25th, 2022 meeting minutes. Do I have a motion?
I move we approve it.
Thank you. Do I have a second?
Second.
I think we had Norman. I think Terry was second. Any edits, comments, suggestions, discussion related to the meeting minutes? All those in favor, say aye.
Aye.
Any abstentions? Any opposed? All right, they pass unanimously. Thank you. The second item on the agenda is the director's report. So want to share some clinical services updates that Darlene has shared with me to share with you all. So our clinical services are currently active and we're seeing individuals by appointment as we have been for a while now. We do have two part-time mid-level providers, which has been really great for our clinical services. So we have a physician assistant and a nurse practitioner who are helping to support our clinical services. The physician assistant is providing latent TB program services twice a month and is training to provide travel adult immunizations twice monthly. And the nurse practitioner is currently training to provide care in our sexual health clinic, which is currently being offered 2 days a week for a total of 6 hours. When she is fully trained and onboarded with our clinical services for sexual health clinic, we hope to expand our program hours so that the clinic will be offered 3 days a week for a total of 12 hours. You might recall prior to the pandemic, we were offering sexual health clinic 3 days a week. Our hope is to continue to grow the program, to expand to include women's health services such as pap smears and family planning. So that's the goal. But for now, we're hoping just to expand to 3 days a week. Our childhood immunization services have been pretty slow. We've averaged about 3 to 4 children per month coming in for immunizations. And as we discussed last month, our flu administration is slowing down, which is what we see typically every year around this time. We're averaging about 1 to 4 people per week that are coming in for their flu shots. And this is also being done in conjunction, as we've discussed, with the COVID-19 vaccine booster clinics on Thursday afternoons. Some upcoming events that we're preparing for communications and social media posts on March 24th is World TB Day. So we're planning a press release and a social media campaign. And April 2022 is STD Awareness Week, which is the second week of April. So we're also coordinating communications around those weeks. So those are some updates with our clinical services. In community health, we're also on our social media, we're also celebrating Black History Month for February, as well as National Heart Month. So if you haven't seen our recent posts on our Facebook page, our social media accounts, please check them out. So we're celebrating both of those events this month. So those are my quick updates. Anybody have any questions or comments related to those?
A question about the immunizations. Certainly across the board, we've seen decreased in kids getting their updated immunizations. Is there an effort on the part of the city to reach out through our to the kids that you have in the past taken care of?
So we have our, through the IEP program, we're tracking a lot of that, working with the providers to keep, to make sure the kids are up to date. So there is a continuing effort related to that, related to the Immunization Action Plan program. And I could ask Pam if you're all interested in hearing more details about, what's going on in that program to come present at a meeting. Is that something you'd be interested in?
Yeah.
Okay. Mm-hmm. Megan, I don't know if you have anything to share related to IEP. We also have the, the COVID IEP program, but related to the traditional IEP.
Yeah, I mean, Pam is the coordinator for the traditional IEP, which is, they're doing outreach to all children who may be behind or missing any of, vaccine for Norwalk and the surrounding towns. And so she would be able to speak better to a lot of the outreach and the work she does and her team does in tracking these kids down and getting them back into care if they're not. I know a lot of times if somebody has lost insurance or, is, in between providers, she does try to refer to different clinics and even our own immunization clinic if we're able to vaccinate them. So, we do follow up, I would say, with patients we've seen, if they've come through our immunization program, but also patients that are, at different providers. I know it's a lot of work and I know Pam's always busy doing that. So I think it would be great to have her come and present so she could speak a little bit more on that work.
So we'll follow up with her and see if she's available to present next month on the IEP program and immunizations in general. We can also ask Darlene to join as well. Thanks, Dr. Weinberger.
One other thing I just was thinking of, I know, I know around COVID, a lot of children and families might have fallen out of care or fallen behind. And so I know the state as well as Pam's program has done a big push to make sure that, that folks are keeping their appointments unless they're having, COVID related symptoms, but to make sure that they're following back up with their providers when they are feeling well. So I know there was a big push from the state going down to locals to make sure that we're letting people know that it is safe to go into, the providers' offices and they should still keep those well visits because of the importance of, staying on track with their immunization. Like I said, Pam would be the best to speak on this, so.
Thank you, Megan. Any other discussion? All right, our next item on the agenda is the Community Health Worker Initiative. So Teresa has some really great updates to share related to this. Some great news. So Teresa.
Hey everybody, good morning. I'm going to share a PowerPoint just to keep me on track so that I don't go off on too many tangents, but let's see.
We can see it, Teresa.
Cool. I just get it into slideshow mode. Okay, there we go. So I know that I have mentioned our work with community health workers in previous meetings with this group and others, and just wanted to provide a little bit more detail and structure around the work that we've been doing pretty much since fall of 2020, utilizing the value of community health workers in some of our COVID response, and excited to see that work grow as well. So what is a community health worker? So what we discovered, as we do research and are looking into how you define a community health worker, is that the health department has utilized and employed folks working in this capacity for quite some time. They may have been called outreach workers, they may have been called other titles, but a community health worker, as the APHA's CHW section defines it, is a frontline public health worker who's a trusted member of and or has an unusually close understanding of the community served. Their trusting relationship enables the worker to serve as a liaison between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. Community health worker also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. So really, these are folks who have a real strong and close connection to the community, who are often bilingual and bicultural, understand the community resources, but also some of the cultural influences for certain groups in our community. But that second piece about building capacity is really huge, and that's what we found with a lot of our community health workers, is that they are helping folks build skills and confidence to seek out their own health information, to access healthcare providers, to access social services, so that they can also spread the word to other folks in their friends and family and networks. So I want to talk specifically about our first real initiative around community health workers as an official title. And that was in a partnership with FCA, or Family and Children's Agency, here in Norwalk. And so in fall 2020, the Connecticut Health Foundation approached us and said that they would like to support community health workers in the Norwalk area and several other towns and cities around the state of Connecticut. It was a very rapid timeline, and the grant was only proposed to be about 6 months. And so we partnered with Family and Children's Agency, knowing that they had a lot of infrastructure to be able to get a program like this up and running very quickly. So FCA hired, trained, and deployed 5 community health workers to assist with our COVID-19 response. Those 5 CHWs and their supervisors joined our contact tracing and COVID-19 response team and was fully integrated into the team. So all of our team meetings, our trainings, updates, and those sort of things included this team of folks from FCA. We met continuously. At some point, we realized it was about 3 times a week. We were having large team meetings, in part to keep up to date with all the COVID-19 information as it changed so quickly. And also in part because the roles and responsibilities of the CHWs and the rest of the COVID response team was changing and evolving as the pandemic changed. So I'll talk about this a little bit at the end, but we're excited that the partnership with FCA has continued and continues. We were able to secure additional support through the Vaccine Equity Partnership Fund. And now the program continues with CDC funding in cooperation with some of our state partners as well. So the CHW Duties, through this particular partnership, they assisted with case investigations, contact tracing, and monitoring. They provided individualized education, support, and connection to resources to everybody that they spoke to through that contact tracing and monitoring process. We work closely with state contact tracers and the regional community resource coordinators to create a local workflow for referrals to different community resources that were out there to allow folks or to enable them to quarantine and isolate effectively. So there was a large state network and state program in place. And what we found was that the CHWs, because of their very unique skill set and lived experience, were able to really connect folks with resources a little bit quicker, and knew of really niche resources in the community that they could locate for folks. And that they were developing relationships with the individuals that they were speaking to over the phone through contact tracing. So rather than bump them off to somebody else to call and follow up, they were able to serve both functions, right? To do the contact tracing and education, but then also to make sure that they got any assistance that they needed that was available. And then because FCA is a very case management oriented organization, they offered intensive case management to folks who needed it. And they followed up with support often beyond the quarantine and isolation period. So if you're familiar, if we spoke about it, a lot of some of the resources that were available at the state and regional level were only available during a person's quarantine and isolation period. And depending on what part of the pandemic that was in, that may have only been a week or 10 days. And so there was a very short window in which some of these programs and resources were available to folks, but FCA was able to continue, those CHWs were able to continue working with them beyond the quarantine isolation period to make sure that all their needs were met. As the waves of the pandemic ebbed and flowed, at the beginning, a lot of their work was around contact tracing and phone work with individuals and families. And then as cases started to decline a little bit and the weather was more conducive to in-person outreach and education, they started to do some amazing work building networks and relationships out with community stakeholders. So they did outreach to faith leaders and other key stakeholders. They created information sessions. They distributed educational materials in person about vaccines and also about other COVID precautions. So they did a lot of work educating people around masks, testing, staying home when they felt sick, working with their employer to make sure their employer understood guidance and, enable them to return to work when it was appropriate. They did a lot of door-to-door canvassing, just knocking on doors, hanging door hangers on people's doorknobs, starting up conversations. And then they also went to, you know, what some would call non-traditional health agencies like laundromats, salons, and barbershops, right? So where people weren't expecting to get information about health, but got a lot of information, and then knew that when they came back next week, somebody would be there to answer their questions and to help clarify things for them. They did do some in-person vaccine information sessions, and also did a lot of assisting people in finding vaccine appointments or clinics, right? So we have been trying to push out as much as we can comprehensive weekly schedules and vaccine information line to assist people in making appointments. And so the CHWs were able to do a lot of that good work, having folks call them and say, all right, I've decided, you know, we've spoken over the course of several weeks. I decided I'm ready to get a vaccine. Where can I go? How do I do it? I'm overwhelmed by all the search engines and VAMS systems. And so they were able to assist with that. And then also really importantly, they built really strong communications relationships and networks with people in the community, so that, you know, maybe they spoke with, developed relationships with someone in early 2021. And then when boosters became available, they were able to go back to those same networks and reestablish those lines of communication to get word out to folks really quickly. And they became really trusted representatives and messengers in the community. And we hope that as time goes on, they're able to grow that work and those networks to parlay into, you know, other health education and community health improvement work as well. So in terms of outcomes for this particular initiative, these CHWs supported, connected, assisted, and educated thousands of Norwalkers, both through the contact tracing over the phone, individualized education and support, but then also a lot of their public education and information work that they did. They strengthened and expanded our capacity to respond to COVID-19 in general. They provided valuable feedback about community resources that were needed, where there were information gaps, and then current trends in the pandemic. Often before quantitative data was available, or in times when there was no way to capture data, they were able to provide us with anecdotal evidence. You know, we were seeing a real increase in the number of folks requesting food assistance, or the information out there about quarantine and isolation since the CDC changed their guidelines is really not resonating with people. We need a different way to communicate it. So that kind of feedback was incredibly helpful in our response and continues to be so. And then this program also really strengthened our, you know, we had an existing partnership with FCA. We have always worked really well with them, but this has really strengthened that partnership. And then, as I mentioned, helped to really connect us and strengthen the networks we have with other stakeholders in the community. So the Connecticut Health Foundation contracted with external evaluators from the University of Massachusetts, who did some evaluation of this program, both in Norwalk and with some of the other towns and cities that participated. Interestingly, almost every city used and utilized their community health workers slightly differently, right? So the Connecticut Health Foundation allowed us a lot of flexibility to help utilize the CHWs in the way that our community needed it most. And so it was difficult to evaluate the program as a whole because everybody used, the CHWs worked in lots of different ways. However, they did ask the CHWs to distribute surveys to many of the clients that they worked with. And it was a small subset of the overall number of folks that they reached, but of those people who responded, of the ones who discussed medical and non-medical needs with the CHWs, almost 81% of them had all their needs met. The evaluators pointed out that in times when the needs weren't met, it provided some insight into where possibly more resources were needed, right? Where the CHWs identified a need or the client identified a need and there wasn't something that could assist them in that way. The survey respondents rated the CHWs very highly on all aspects of their interactions. And then the evaluators did some financial analyses and concluded that the number of COVID-19 cases that were averted because folks were able to quarantine and isolate effectively thanks to that assistance, offset the cost of the program, which we found was really encouraging. And then our next steps, as I mentioned, the CHW partnership continues. Right now, it's currently being funded by a CDC funding through the Department of Public Health and the Office of Health Strategy at the state level. And then also, excitedly, I think I've mentioned this before, we have been able to bring on 3 community health workers through our immunization action plan program, the COVID-19 response portion of that program. And we plan to, they're integrating into the team. We're connecting them with the FCA community health workers so that we can strengthen those connections they have in the community and expand those as well. The training and onboarding has taken tremendous, a lot of information from the lessons we learned through the FCA partnership, and we'll continue to integrate the values and principles of community health worker work throughout a lot of the initiatives that we operate moving forward. So excited, hopefully in the coming months to share some more information on the external evaluation of that partnership with the Connecticut Health Foundation, but also news and about the expansion that we have with new community health workers on board here as well. Thank you.
Thank you, Teresa, for the really great presentation. It's just really exciting to see all the progress and all that we're able to do. So thankful to the Connecticut Health Foundation for their support, to FCA for stepping up and for doing such an incredible, amazing job. And just really hopeful for the future, right? So those lessons learned and how we can apply them moving forward to other areas. So thank you, Teresa. Amazing job. Any questions or comments from the board?
Do we have a lobbyist that we work with at all? Do we ever get into that legislative process and understanding what's going on? Because I think there's a couple of bills sitting out there right now to fund, actually pay for, CPT level pay for community health worker initiatives. So I don't know if we had a lobbyist that works on our behalf in any capacity at the state level, because session's in and the bills are flying around, and it'd be really nice to support a community health center, not community health center, a community health worker initiative, and bundle that together. Just didn't know if you had internal resources for that.
So a lot of the membership organizations that were part of, like the Connecticut Association of Directors of Health and others, they engage in advocacy work. And so we can follow up like through those channels to see research on what's going on at the state level and see if there's any movement on those bills. So yeah, we can definitely look into that through those organizations. I mean,
the health department could be, either provide testimony or whatever. I think there's ways of enhancing this process, because there's a bunch of initiatives going on. We have one that's going on that brings 8 community health workers to the table. I don't know whether you guys have connected with them or not. And it's exactly a very similar program that you guys have. And the key is getting it funded ongoing. That's the hardest part of this whole thing. So if you can get it such to a point where you can bill for those services, that would be, that's the ultimate, because that'll continue the program on in perpetuity. So
yeah, we're also really involved with the Connecticut Office of Health Strategy, who I believe has taken on a lot of the oversight for the CHW credentialing and training. And so we're in communication with them. Part of the work of the evaluators for this program was to see what kind of evidence was out there to support such efforts to get funding. And so that's part of the reason we wanted our CHWs to participate in the evaluation so strongly, is to kind of build that evidence base to show folks how important this work is.
Yeah, I actually sit on a couple of their committees, so it's the office does an awful lot for being just an office, not a commissioner. So
is that something, so getting back to Ken's point, is that something the board would be interested in submitting testimony related to, like as the Board of Health?
Sure. These community health workers are an invaluable investment in public health and in making sure that people get to where they get to, particularly in the areas that you've been discussing, and the essentials of life and where to get them and how to get them. And they are certainly in our organization, they are more trusted than we are.
So is that something you want to make a motion for now to draft something, or bring back to next month to, talk about specific bills that might be proposed going through the session?
It's something we have to act on, I would say, fairly quickly. A month, it's a short session. So, I mean, a month from now, it'll be close to being done. So, I mean, I'd make a motion that we look into opportunities to enhance the communication and or acknowledgement of community health workers and their impact on the state's health.
Second.
All right, any discussion? All those in favor of that motion?
Aye.
Everyone, I'm not even gonna say opposed or abstain because you all just said yay. Okay, so, all right, motion passes. All right, great, thank you. Any other discussion related to community health workers before we move on to COVID-19 updates? All right, thank you, Teresa. Thank you, everybody. All right, so I'm gonna pass it on to Brian Weeks, our epidemiologist, to begin our COVID-19 updates to see where we are with cases. Good morning, Brian.
All righty, well, good morning, everybody. Here, let me share a screen and we'll jump right into it. All right, so what you should be seeing on the screen is just a reminder that all this information is up to date as of the morning of February 22nd, 2022. Just wanted to mention, it's pretty neat, 2/22/22 for the date today. So we missed obviously 2:22 a.m., but still have it if you don't follow military time for 2 later today. I just thought it was really cool. All right, anyways, moving forward now in terms of the CDC levels of, COVID-19 county levels of transmission, as we usually see for the last 7 days. As you can see, for a good portion of the county we're still in the high category, 92.61%. Although, as you can see, the color palette has changed a little bit, especially in the Midwest and a little bit part of even like the West Coast or even some of the South. You can see how some counties have entered the moderate or even low categories for COVID activity. So it's good to see that, Connecticut's kind of still holding steady with high, but we're getting there. We're getting very close, actually, in terms of breaking into, say, the substantial category, so orange. But nonetheless, if you look on the left-hand side, in terms of the PowerPoint slide, we're still at, almost 426 million global confirmed cases, 5.9 million almost global deaths. US confirmed cases almost at 78.5 million, and then US deaths at almost 936,000. So we're getting closer to almost 1 million death mark for the pandemic, given the fact that we're getting closer to, especially for, say, the state of Connecticut and Norwalk, the 2-year anniversary for the pandemic. So moving forward into the next slide here, you can see how CDC's SARS-CoV-2 variant surveillance is keeping an eye out now for BA2 compared to what we discussed during that previous meeting. They still stratify by even with Omicron, as you can see with the purple, the darker shade and the lighter shade, but then you can see a very light pink here, which is BA2, which is going to be very important to keep an eye out for, given the focus it currently has in the news, as well as the impacts it's been having in certain countries too. It is present in the United States. It's just a matter of how much impact it's going to have. So keeping a close eye on that's going to be really important. But as you can see in the United States, based upon region, you can see how the Eastern Seaboard as well as the West Coast have the most prevalence in terms of BA2 and technically incidence too. And then also you can see here for the state health department and their surveillance. I mean, they're still not stratifying for BA2 yet, but they are looking at strictly as a group in terms of Omicron. And you can see how pretty much again it's the Omicron show, as we're well aware of in terms of the last few weeks. This data is up to February 5th. So if you look at the state health department's town and city COVID case rates framework, this is still using their original framework in terms of the high activity, kind of like how the CDC does it. You can see how Norwalk is at 17.1 cases per 100,000 with the new reports. This is reflective of data of January 30th to February 12th. You can see how still, the lower part of Connecticut is still experiencing high activity. So that's 15 plus cases per 100,000 in terms of activity. But you can see how certain parts of the state are still starting to exit that and entering maybe the 10 to 14, if not lower, the less than 5 cases per 100,000. So we're getting there in terms of this palette changing because it's been red for quite some time with the Omicron surge. So again, indicating that, we're experiencing that downtrend, that gradual downtrend in terms of activity. And then you can see it also here too, in terms of COVID-associated hospitalizations for the state. So this is data reflecting March 2020 to February 21st, 2022. Again, you saw the 2 peaks that we do have relative to the pandemic. And then, how we peaked at 1,939, but then, we did have, a very nice downtrend in terms of activity over the many weeks. And so that gets us now currently to 261 COVID-associated hospitalizations for the state. So really great news. In terms of proportion, especially looking at the 3 largest counties, Fairfield, Hartford, and New Haven County, you can see how the largest proportion is Hartford with 37% of that, New Haven 29%, and then Fairfield County at 19% of that. So just another thing to keep in mind as we continue to see this downtrend. But nonetheless, a great curve to see. And so you can see also reflected in terms of our case rates when you look at the big 7 Connecticut cities. Again, Norwalk at 17.1 with the percent positivity of 5.7%. And then you can see how, the lowest is Danbury at 15.9, and then the highest is Waterbury at 29.2 in terms of the case rates. So you can see how the spectrum has changed quite a bit so that when you compare it to even just a few weeks ago, where Norwalk is at 260.4, Waterbury was at 274.8, and then Danbury was at 206.6. So for the entirety of the pandemic, you can see how Norwalk has about 21,227 cases, 256 deaths. So that actually just increased by 2 from the previous week. And then also in terms of age groups impacted by COVID for the time period of February 6th to the 19th, you can see how this trend's still holding. So the last couple of weeks, we saw the less than 10 years of age group being usually the largest proportion. I mean, you can see how 30 to 39 is caught up before. It wasn't as high with the previous week, but less than 10 years of age, still very high, especially in comparison to its slightly older peer, 10 to 19. So just important thing to keep in mind that COVID's still impacting, the whole spectrum of age groups. It's still having kind of that bell curve, as we've always seen with 30, 39 and 40, 49 kind of being a good proportion of that, but less than 10 years of age, given especially, the various items that may contribute to that or factors. One being that, the legibility for less than 5 years of age, but then also the late eligibility that came for this younger age group too. Although, as you'll see with the vaccination data, how the 12 to 17 group has been doing really well with vaccine uptake as opposed to, say, the 5 to 11, which is eligible. So it is just another thing to emphasize. So let's actually jump to that slide now so we can kind of see that. So again, left-hand side table is looking at the city of Norwalk relative to vaccination percent coverages by age group. And so you can see here an orange row here that's new. It's coming from the state health department. So it's looking at additional doses received. And so it's just kind of factoring booster doses or additional doses relevant to individual circumstances. So you can see, let's start off with the fully vaccinated because that's most important in terms of, what we've been advocating for, but then also obviously maintaining that immunity in lieu of waning immunity with those additional doses. So overall for all ages, 77.48% for fully vaccinated. As you can see, pretty much 100%, if not, pretty close to it in terms of 65 plus, because this is based upon census estimates, so there is a margin of error. 90.95% for 45 to 64, 80.47%, 25, 44. Then 18 to 24-year-old age group, 76.33%. And then you can see 12 to 17 in terms of fully vaccinated, 85.34%, but then 5 to 11, still notable in terms of 34.02%. And so it kind of, again, suggests, what the impact is in terms of that proportion relative to especially the recent 2 weeks for COVID cases. But then looking at booster doses, naturally 5 to 11 is not eligible. But then we look at say the other age groups, it does follow an age gradient very closely. So the older the age group, the more booster doses that have been, uptaken. So you see 75.64% for 65 plus, 49.75% for 45 to 64, 30.54% for 25 to 44, 18 to 24 with 24.11%, and then 12 to 17 with 21.57%. But again, you can see that gradient there, and still ways to go, especially for, say, the middle age to lesser age groups. It's just really important to keep in mind. But even, again, 45 to 64 still has a ways to go too. So overall, an additional dose received percentage based upon the state's estimates is for all ages is 36.13%. So it's just something really important to keep in mind, given that, those booster doses are necessary to maintain that immunity, given that, especially around 4 to 5 months, it definitely decreases quite a bit after somebody becomes fully vaccinated. So just an important thing. So this just wanted to advocate for that. And so along with that, with COVID testing, we still have our site over at Shady Beach 7 days a week. Still really important for individuals that suspect they might have been exposed to COVID and need to get tested, or if obviously especially symptomatic and they just want to kind of figure out what their status is and get confirmation, especially via PCR test. So that's definitely a great resource to have and a great partnership. Then we also have the City of Norwalk COVID-19 vaccinations. So just advocating for that, check out the web link if ultimately, you're interested in a clinic or still need to get up to date in terms of your vaccinations, those booster doses. So the other thing to keep in mind is in the midst of all this flu surveillance, but what's actually really good to see with this is, especially for the Northeast, influenza-like illness activity has decreased to, if not minimal levels. For really kind of the eastern seaboard and even parts of the West Coast. So it's really more like the Midwest and the South portion of the country that's still experiencing maybe moderate activity relative to influenza. But again, this can always change, especially with the various things that are going on in terms of prevention measures. So it's something to keep a very close eye on. And hopefully the winter time also doesn't kind of drag on too. But, fortunately the weather has been much better, but as I understand it, the weather's going to switch after Wednesday to something else a little bit more familiar in terms of wintertime. So with that said, all this information is available on our weekly report, especially in terms of the mayor's letter. And so definitely checking it out every Friday afternoon. Again, it's on the city webpage and social media. And that is the overall update on COVID-19. Thank you.
Thank you so much, Brian. Does anybody have any questions about cases, where we are?
Any word that on what might be happening in round 2 of, the fall, headed towards the fall? Are we looking at another round? Is this going to be, boosters forever? Is it going to be certain strains that would be similar to what we do for flu? Are we going to start packaging that as a one-stop shop, going to get them both?
So I can start. So yeah, I think the flu model is definitely very much in play. So just kind of, especially based upon vaccine effectiveness and the ability for the virus to kind of mutate and evolve and kind of evade that too, especially with even BA2, because there's that preliminary research that's not only suggesting it's 1.5 times more infectious than the original version of Omicron we've been dealing with, but also might be potentially more severe in terms of health impacts, which still needs to be better understood. But just even suggesting that in the midst of Omicron, that's really kind of changed the game. So in terms of vaccine, as I think there's still going to be very much in play. I think there's still talks even now about a 4th booster shot that's going to be potentially evaluated and entering the mix too. So I think we should anticipate that, because with waning immunity, it seems to be around 4 or 5 months based on preliminary information that, everybody kind of reduces that immunity to the point where, you really need to get that booster shot. So yeah, following the flu model, but just maybe potentially getting those additional doses, especially in preparation for the fall time as the weather cools and we anticipate COVID activity to pick up. So there's a seasonality with this. As I showed, especially with the hospitalization data, you can see it very distinctly how the summertime, it tends to decrease to be kind of almost background noise levels, never get quite to 0. consistently, but then it picks up again as the fall time approaches, and especially it peaks around the winter time, especially with the holidays. So the big things are seasonality and the holidays, and social gatherings and opportunities for additional transmission to occur for things that pick up, and also variants that do exist globally speaking, if not also inside the country, have more opportunity to spread and give them a chance to really kind of flourish, quote unquote, in terms of impacting the community. And say, for example, especially Connecticut, and given our proximity to very high density populated areas with a lot of travel and things like that, like New York and New Jersey, inevitably Connecticut's going to get impacted, once that kind of kicks off too. So we're usually the first to see it after New York, per se.
There's actually New York Times had an article just today, I think, there's talking about, there's some new studies talking about, do you need a booster? How obviously you need a booster, but like, will you need it? Like you're saying, Ken, like every year, or like, will there be certain, sectors of the population that will need it more frequently? So I was just reading through that this morning. I can send that around too if people are interested in seeing that, some of the more recent studies that are looking into it.
The CDC has already recommended a fourth booster for immunocompromised people. So yeah, that's going to happen.
Thank you, Dr. Weinberger. But yeah, so that kind of goes into, we're thinking, I know like nationally, locally, statewide, everyone's thinking about, planning ahead and what's the next phase of this and how do we, how do we prepare, right? If there is a variant, if, new variant that impacts us, the seasonality of all of this, like what is the role, of our health department moving forward, through this response. So like we've been thinking through that, as treatments become more available, how does that help? So we're thinking through all of that.
Our role also has to be partly just good old fashioned public health. Wash your hands, wear a mask when you're sick, don't go to work if, all the standard plays that are really public health, which is, we have an opportunity, in my opinion, that, COVID has kind of brought this to the surface. I think it's our job to make sure it doesn't get pushed to the back burner.
I think
it's not over. Yeah.
I think Ken is exactly right. I think that it's going to be a public health issue to remind people that these mitigation procedures are going to be very important, not just for COVID, but for general health.
How are we going to get people to fund those campaigns?
Yeah, right.
I mean, it does go to the importance of community health and health education and health promotion. And I do want to thank you all and the mayor for supporting that too. We were able to, create the assistant director of community health, and maintain our health educator and grow the community health worker program. And so I'm really great about all the infrastructure building that we've been doing over the past few years to help us, apply it into a lot of different areas of health. So I am hopeful to that. So we got the people, right? The people resources.
Yeah, it's kind of the crazy thing. The numbers are going down, so people think you need less. Actually, the numbers are going down because you put in more.
Absolutely. All right. Are there any other questions, comments related to COVID-19?
Deanna, do you want to speak a little bit about what just came out from the state about the recommendations?
Sure. Do you want to start, or do you want me to just?
Up to you.
So the state health department and the State Department of Education on Friday, late Friday, released their guidance to schools related to, it's 2 guidance documents for use in pre-K to 12 school settings. So the first document is about assisting schools with transitioning to a model of COVID-19 management that aligns with the state's public health approach to the routine management of respiratory viral diseases. So kind of getting to what we were talking about, does this become more similar to a flu model in the future and moving forward? So they provided that guidance document. And the second one is some more like frequently asked questions. There's questions to consider when contemplating potentially changing, for school systems to the, their policies related to masking, and schools are transitioning to mask optional policies. So those just came out on Friday. And so we're looking through them, and we'll be discussing them in partnership with the school system moving forward. Dr. Weinberger, I don't know if you have anything to add related to that.
No, I just think we should know that this is coming down and it's going to be a discussion with the school.
So I can also share that with everybody so they can see that. Thanks, Dr. Weinberger. All right, our last item on the agenda is public participation. I see that we do have an attendee. If you would like to speak, can you please raise your hand? I'm not sure if you're just observing, if you'd like to speak, but if you'd like to speak, you can speak now. All right, I'm not hearing anything, so I'm assuming not. All right, thank you, everyone. It's 8:48, and do I have a motion to adjourn?
So moved.
All right, second. All right, all in favor. Thank you, everyone. Hope you have a great day.
Bye-bye.